So what I'm going to talk about is using the Delphi method to determine a case definition of climate change mortality. And I'm going to really, I guess, Joseph, you'll be happy about this. My Irish is going to come out.
Yeah.
I'm going to tell a story of us trying to get to this. I do want to give a shout out to my fellow collaborators, Dr. Kabindra Shekha back there from Villanova's Department of Geography and Environment. Also, Rachel Baskin, who was a doctoral student, worked with us with data analysis, and she is now she's a PhD and now assistant professor at Widener University. And then Dr. Julie Becker, who Julie passed away last year. Julie was an environmental mentor of mine, an environmental health leader within the area, and she was from Physicians for Social Responsibility. So that was our team working on this. So in 2019, I drive around and listen to the radio. I'm kind of a geek. And I listen to the news. And so in 2019, I heard this news story on the radio about this young woman who was pregnant and had her 8-year-old son in the back of the car. And torrential rains came down, the car flooded, and they died. They drowned in this accident. And people were talking about the horrors of this, but no one mentioned climate change. And I'm screaming to the car radio, as I will do, because I'm alone. This was climate change, and no one was saying anything about it. And that just stuck with me, and it really bothered me. And it turns out, the year before, in Japan, there was an incident of an extreme heat wave, and 1,000 people died from that. And they used what they called attribution science to determine this was climate change that caused that. So this is happening. We're starting to finally identify climate change causing death. Okay, and it happened in Japan. The problem is that we're just looking at these incidents as a single incident. In other words, we're looking at all heat-related deaths, or we're looking at all hurricane-related deaths, or wildfire deaths. And we're not getting the true picture of what climate change, how it is impacting human health, because we're looking at it in isolation. And I do come from a place of advocacy, and as a public health person, I realize the only way we're going to do this is to change policy. And the only way we're going to change policy is if we go to Washington with the real numbers of what's really happened. And so that's really what's driving this work. So you can see, this is from NOAA, the weather fatalities, and you can see they listed flood, lightning. I honestly don't know how they define lightning. I mean, I know what lightning is, but it's single weather events and this data is from 2024. This would be the most recent we'd expect. I honestly don't know if 2025 data is going to be shared on NOAA, but we wouldn't expect it by now anyway. It takes a while, so we'll just keep an eye out for that. But that's what we see, and I actually last night I did a PubMed search again, climate change and mortality, and all came up as single events, except for our one article that I'm going to get to. So our question then was, how do we put together the full impact of climate change related to death? The reason we're looking at death is it is known as a vital statistic. And so it's reportable. And so it's kind of easier to track if it's reportable. It's not as easy as you think it should be, but it is easier to track. So I thought, okay, let me call the Pennsylvania Department of Health and talk to them about how do I access these records and what's available. And they were actually great. Our state health department was helpful in accessing these records and for me to look at what I wanted to find. However, it only really told me what people died from. And it told me really from kind of a medical diagnosis. So someone died from a heart attack, or someone died from kidney failure, or pulmonary embolus, or whatever. It didn't tell me any kind of relationship to what was happening in the weather. And sometimes they would get the diagnosis of, heart failure or heart attack when it was really a heat-related illness. So we weren't getting that information that we really needed. So, and that gets into a whole bunch of problems that I don't have time to get into today, but I've learned more about death certificates than I really ever thought I needed to know. But what our group decided to do was, let's look at all of the published information about climate change mortality. What is killing us related to climate change? And you'll see it's in the United States, and we purposely are only looking at the United States because there are enough confounding variables here. And so if you think about what's happening across the world, we've got different health systems, we've got different emergency responses, and so we're trying to keep a very complex thing as simple as possible. And what we essentially, this actually helped us really do a deep dive into what is causing death related to climate change. And what are those other factors? So certainly heat is the primary reason people die from climate change. And then, also flooding and wildfires, and all those things popped up. But also things popped up that during a heat event, you're more likely to have an accident. So we learned that. We learned that there's a gender difference. And women can be at greater risk in certain times, and men can be at greater risk at other times. We learned about occupational exposure. So this was very helpful to do this. And again, Cobbin was one of the authors, and an undergraduate, Madeline Scalio, who is now at Penn working on, I think, a master's in urban planning or something like that. And then Carolyn Moore, who, again, a PhD graduate from our College of Nursing, and she's down at Mercer University. We gave students another example, and I'm going to say something else. Caroline was not a believer in climate change until she started working with us. So one person at a time, we're moving along. Anyway, one of the things that is really exciting about this particular article is we were cited in the U.S. Fifth Climate Assessment, and that is the premier document of the U.S. about climate change. And it has everything in there. And then they have a section on human health, and so we were cited in that. This, unfortunately, as of now, it was the last one that they have. It was mandated by Congress to provide one of these at least every 4 years. Some years it was every 2 years. And the group that came together in 2025 to get ready for the next document has been dismissed. So again, something important for you to talk to your legislators about. So we found that there was no definitive answer. We just thought, let's go to we'll write this article, we'll understand it, and then we can go back to the data with the health department. But it has not been that easy. So we decided we needed a case definition of what is climate change mortality. Are there any nursing students here? Yeah. So I'm not going to put you on the spot as the only one. But hopefully, at least in your some of your public health courses, you've learned about a case definition. And what that is it's something that creates the parameters of a disease state. Okay, so if you say diabetes, you need to have certain blood sugar levels to be considered diabetic. And so here's some examples, and this is a pretty common one. Many people either have hypertension, high blood pressure, or know someone that has it. And they didn't just pull these numbers out of a hat. Actually, what happened was experts came together in the area of cardiovascular disease and looked at U.S. data, the Haynes studies, and determined what are the parameters for blood pressure. So this is essentially the case definition of what high blood pressure is. Okay, so that's one way that we can look at high blood pressure. Something that may be more familiar to all of us, because we all lived through it, was the coronavirus. During COVID, we heard early on all these kind of vague symptoms. And again, a group of infection control experts came together and said, what's going on? And let's start identifying. The same thing happened with HIV or with AIDS. Like this strange thing's coming along. Let's try to put it together and say, this is what it is to have coronavirus or COVID-19, or in the other case, HIV or AIDS. And so if you remember, it was things like respiratory disease. We had some things with funny taste in your mouth, maybe some mental confusion. So all of those things came together. And this was even before we had testing. And then they threw in the testing to really say, confirm this is the case. Okay, and this is really important for medical diagnoses, but it's also really important in public health to make sure we're identifying the correct cases. And then one that's more environmental related is who is it? It's the Environmental Health Project out in Pittsburgh. They work with fracking, the unconventional oil and gas development. And so that's where they're pulling natural gas out of the ground. And so people who live close to those fracking sites were coming down with illnesses. And so the group out in Southwest PA decided, again, they brought in an expert panel. Let's look at what are those symptoms related to fracking. And then they took it further and did a Delphi, and that's what we did. And what a Delphi is when you take, again, a panel of experts and you ask them, how would you rank this as meeting the particular question that we want to answer? And in this case, it was, what is the symptoms, or what are the symptoms that make us say that this is a fracking-related illness? So that was, this actually, I was aware of this study, and this is what kind of, again, thought, well, let's try this. So we decided to use the Delphi method to come up with the parameters of a case definition for climate change-related mortality. And so we brought in a panel of experts, and we had two major research questions. One was, what are the parameters of a case definition of climate change mortality in the United States? And what's needed to improve accurate reporting of climate change mortality in the United States? And with the Delphi, again, you have people who have expertise. So, I wouldn't just go to Target and stand outside and say, do you want to do my survey? People have to meet a certain criteria. So we are really, purposeful sampling of that group of people. And so our first round was 13 experts and these are their fields. So we had 6 in medicine, a variety of areas of medicine, 2 nurse practitioners, 1 in environmental policy, an environmental lawyer, somebody in public health who was an epidemiologist studying climate change, and then a climate scientist. I know I can't share with you who these people are, because IRB and all that lovely stuff, but I can guarantee you that these are experts. Like if you were going to pick out a lineup, you would want these people there. And the way we found them was we went back to the national national assessment, the fifth national assessment. And we're like, who's publishing in this area? So we looked at those people, and then we also did some snowball sampling where we had people, identify who else we should talk to, and we came up with these people. We're kind of heavy on as far as where they were, because we really wanted to try to get as broad a swath of the U.S. as possible. So we're a little bit heavy on the Northeast, with New Jersey, New York, and Pennsylvania, and Delaware. But we did have 2 from California, 1 from Colorado, 2 from Florida, and 1 from Texas. So that, is probably what you would expect. People from Wyoming, for the most part, I am generalizing, or Oklahoma, are not, screaming pick me for this. Like this is kind of more of a typical sample. But I'll show you what we did to try to get it more broad. So that was the first round. And what we did is we had a focus group with 7 people of those experts, and had a series of questions about, what do you see as the important features of a case definition? What were the barriers? And a variety of things came up, including things like what we call the social determinants of health. So things like economics. If people are housing insecure, if people can't afford air conditioning, those kind of things came up, as well as the typical heat, hurricanes, wildfire, those kind of things. So what we got, so with 7 we did a focus group, and that focus group was you put a bunch of experts, I mean, you've been to faculty meetings, right? You put a bunch of experts in the room, you can't keep them quiet. So it was like, whoa, let's reel this in. And so we did that, and then there were 6 other people that could not come to the meeting. So we did individual interviews. And they were also rich too. The nice thing is we did the focus groups first, so we could kind of like help pull more out from the individual interviews. And then they were all put on transcripts, and we went through all those transcripts and came up with 49 statements. And those statements were put into a Qualtrics survey that was anonymous. And so in the second round, this is how we tried to get a broader swath. We sent out the survey to people who are engaged in environment, in climate and health. And so we did that through professional organizations, the Alliance of Nurses for Healthy Environment, Public Health Association, they have an environmental health section, Global Consortium for Climate and Health Education, and the Medical Consortium for Climate and Health. And so we have contacts with all those directors. They helped us send those things out. And we actually got 140 returns. However, if you heard, we sent it to the Global Consortium for Climate and Health Education. We did that anyway because it's a really strong organization. They've got really engaged people. So we tried to say if you're from the US, but everybody wanted to share people. So we had to pull out those who were not from the US. So it shrunk down to 49 people, 49 participants. Still really strong, but you know, we always want more. So we got, 61 participants from the 49 statements. We had 61 completed surveys that we could use. And so that helped get a larger group of people across the United States, but yet people who had expertise. And then from that, so each survey, what we do is we have people rank like the statement, like, and it went from strongly agree to strongly disagree, and it was 7 points on a Likert scale. And what we accepted was agree and strongly agree. And there's very simple math. I think this is why I love this method. There's very simple math in this. It's called an individual, what is it called? I see the individual, wait, item, okay. Monica, I'm putting you on the spot. You're going to do this. It'll come up. It'll come up. Here it is.
Validity.
What is it?
Item cost.
I'm drawing a blank.
Yeah.
Anyway, oh, here it is. Item content validity, right in front of me. So that's what we use. Thank you, Dr. You read. Thank you, Monica. Awesome. So we and what that is it takes the number of negatives versus the number of positives. So it's a percentage. So it's and what we decided in advance what we're going to accept. The standard in a Delphi is 0.7 to 0.9, and we took 0.8. We did want it strong, but not so strong that we'd lose things. So that's what we took. And so the second round was the expert panel. We went back to them. The third one was a larger group, and then as we don't reach that CBI of 0.8, we get rid of those statements. And so you can see kind of the numbers drop from 49 to 23. We only lost one statement from the broader group, and then we went back to our experts with 22 statements. And so what we ended up with was, and this is really no surprise, all of this that we got wasn't any surprise, but we just needed to validate it. And so we got the things that are important that should be included in the case definition of a climate change related mortality are extreme heat, hurricanes, flooding, wildfires, and then we started off with air quality, and they asked us to break it down. So we broke it out in the types of things, such as soot, particulates, ozone, and wildfires. And in the Qualtrics survey, there was a part at the end where people could give their comments. And so you can see we accepted them or not, and this one we did. We also got mental health, but it wasn't hugely strong. And the reason I believe it wasn't strong, and again, we're going to talk about this in the limitations, is because it takes a while to see the impacts of mental health. And often when we talk about climate change related mortality related to mental health, it's often suicide. So we see this a lot in farmers who are, losing their land because of everything that's happening. And so, it showed up, but it wasn't as strong as the others. And again, when we think about time, but that's something for us to think about as we move forward. The other things that came up, and this is for the second research question, is what are the issues? We have in the United States electronic medical records. So when you go to your healthcare provider, sometimes you feel like they're taking care of the computer and not you. That's what's going on, is they're entering all these data in the electronic health record. We also have ICD-11 codes, and this is the International Classification of Diagnosis, and so it's how they primarily use it in the United States for billing, but it's a gold mine, really, when you talk about data, because they code the data. And so the problem is we don't have a code for climate change, but we do have the Z codes. So the Z codes cover a lot of the social determinants of health, and they cover some environmental things, air quality, some flooding types of things. So there's hope to be able to get a clear one that says climate change. We also do not have, all of our health professionals are not educated in climate change. And it's either, those of us who've been out of school for forever and didn't have it in school and you're working in a situation where you don't see you need to learn it, but potentially you do. And so that's one of the things. And not all schools provide it. And that's another thing that I'm kind of working on the side of how do we make sure that all health professionals have it. So I'm not only talking about physicians and nurses, but also respiratory therapists, physical therapists, public health professionals. They all need to know and understand this. So that is one of the barriers too, because if you think about documentation, if you don't know it's a thing, they're not going to document it. And one of the emergency room doctor that I interviewed shared that in the emergency department, often that person is the only one that understands the relationship of climate change and health, and he or she has to share that with their colleagues. And so, that we're busy taking care of patients. You don't have time to have a class. So that's one of the things. The other thing is, you may have heard climate change is really political. And so that, and healthcare providers we're a microcosm of society, right? We have our little quirks too. I mean, there's healthcare providers that don't think vaccines are a good idea. So that's another thing of documentation. That can be a barrier, and that came up in the discussions of why might somebody not share this, and they may think, well, it's a political thing, it's not real. So that's what we came up with as our case definition. It's weak, though. It's not what we want it to be. And mainly because it is very linear. We just kind of said, what do you think? Can you rate this? And we're talking about a big issue. And we had, a few panelists. They are truly experts, but we only had a few of them, and it would have been great to have many, many more. And because the surveys were anonymous, we could not follow up on all the questions. And so, the comments that people gave. And so that is a bit of a limitation, too. So where do we go from here? Now, there's nothing that bothers me more is when you hear research and go, what we need is more research. But that's what we need. Because at a certain point, with research, you got to go out and do the work. But we're not there yet to do the work. And so we need to move forward. And so our recommendations are for us to develop a way to quantify the nuance of climate change, because it's coming at you from all directions. Not only the environmental change, but policy, politics, all of those things, and how do we address that? So, and how do we link our weather to our weather events to our mortality data? I mean, I actually thought, this is what I thought in the beginning. I could go to the mortality data and say, okay, John Smith died of whatever. Now let me go to what the weather was that day. Well, that's not real. I mean, first of all, it's impossible to do. But usually there's the exposure. A couple days later, they may be hospitalized, and then maybe a week later, they may have died. So we need something for that nuance, and that actually gets into the physiological pieces, the second one. We also need to include climate change into our electronic medical records, and that actually would not be a hard thing to do, because that's within health systems. So we don't have to take on, governments. We just need to take on health systems, which can be a challenge, but it is, it would be easier. The problem is if we have everything housed within our health system, they're very proprietary. Like University of Pennsylvania is not going to be sharing their data with me, and Mainline Health is not going to be opening the doors for me to get to that data. So it will take some time then for us to be able to access those data, but it is a way to get to it. And then again, more support for using the ICD-10, the 11 codes, using those. Our healthcare providers are really, really busy people. And so they do, what they can to get the job done. And charting and putting those numbers down is not a priority as it is taking care of the patient. And so some way we have to figure out how to make that easier. And that can be, again, clipped into the electronic health record. Again, we need to educate our providers and our students. And then we need policies that include a relationship to the cause of death and the relationship to climate change on the death certificate. In other words, our death certificates, and this I've spent a lot of time reading death certificates and reading about how they're completed. And every state has their own death certificate, so there's their challenge. But on most death certificates, they have a checkbox. Is this a tobacco-related death? So maybe we can get some states, I don't think we can get all of them, we know who they are, but maybe we can get some states that would go for, this is a climate change-related death, to start as a pilot, because that could, again, and I just think of some states that might be willing to do that. So, again, I hate when we have to do this, but we have to do this to keep this moving forward, because I do believe this is really important. Is we need to work with data scientists and computer scientists to link those data. So link the mortality data with the weather data, with the physiological responses to those weather data, so we know for each thing, we know which window to open, like the window of vulnerability related to that. So in other words, if somebody has a heat exposure in April, we're not going to be looking at July, but we may be looking, depending on when it is, we may be looking early May. So, but we need the computers to be able to figure all that out, and somebody who knows how to do that. I don't. So thank you very much.